My name is Erin Similuk, and I am a nursing student on the 6th South Telemetry Unit at the VA in Ann Arbor. The patient is a 53-year-old, pleasant, Caucasian male, unmarried, and medically retired. When able to work, he did physical labor. Patient's vital signs are stable, temperature 99.1 degrees Fahrenheit taken orally, blood pressure 140/82, pulse 94, respiratory rate 24, and 96% on room air. Patient's reason for seeking care was shortness of breath related to COPD. Patient came into the ER on March 12, 2015 for shortness of breath and pain while breathing from about 3 to 4 days prior, but he was discharged and returned home. Sunday, March 15, 2015, patient returned with shortness of breath that had worsened and a cough was present that produced green sputum. He coughed so hard that he blacked out, vision darkened, and he could not catch his breath. Denies falls, fever, and chest pain. States that cough hurts back and chest. States compliant with medications and uses albuterol 3 to 4 times per day over the past few days. Aggravating factors include sitting up and lying down in the breathing treatment, but the breathing treatment from the hospital is also an alleviating factor and helps with the cough. Perceives cough and shortness of breath as getting air out but not in. The sputum is green and liquid. He is fatigued from coughing, and it does interfere with his activities of daily living. Past medical history. Patient is obese, has hepatitis C, COPD and asthma, obstructive sleep apnea, major depression disorder, acid reflux, degenerative joint disease, hypertension, gastroesophageal reflux disease, and hyperlipidemia. Immunizations are up to date. Allergies include horse serums. His last reaction was a tetanus shot when he was 4 years old, and he was hospitalized. Hospitalizations and surgeries include a diagnosis of double pneumonia at 6 months old and hospitalization, a reaction to horse serum and tetanus shot at 4 years old, and he was hospitalized. His appendix was removed at 4 years old, tonsils removed at 5 years old, hospitalized for bowel problems when he was 8 years old, hospitalized for exacerbation in 2010 and 2011. In 2013, he tore a quadricep muscle tendon, and that was repaired. He was sent to the ER on March 12, 2015, but he was sent home. Current medications include that he takes multiple medications for pain, anti-inflammatory, breathing problems related to COPD, hepatitis C, coughing, sleeping, antidepressant, hyperlipidemia, and GERD. Functional assessment. His health habits include smoking 1 pack of cigarettes per day for 39 years, but he is trying to quit. He participates in no exercise because he is arthritic in his knees and back. He also reports normal sleep pattern with medication. He requires rest frequently due to his shortness of breath. He is medically retired. He lacks a balanced diet, stating, I eat what I can afford. He tries to limit his caffeine intake to 2 cans of Pepsi per day. His use of safety devices include a walker that he received during his current stay at the hospital. He has a history of heroin use and eliciting cocaine, but he states he quit 2 years ago. Patient used marijuana from 1976 to 2005. Psychosocial data. He lives in Ypsilanti, Michigan with a roommate. His parents are dead. Patient has a brother in Toledo and one in Florida, but does not have contact with either of them. Due to lack of mobility, he lacks face-to-face interaction with friends. He is originally from Toledo, and many of his friends are from there, but it is too challenging for him to return there and visit them. Internet and Facebook are how he keeps in contact with these friends. Times of stress correlate with his depression, and he states he tries to stay away from stress, but no specific stressors were given. He is not spiritual. He used to fish and camp, but he has a limited range of motion now. He even finds driving himself around to be a hard task. Family history. Father had osteoarthritis, congestive heart failure from retained water, emphysema, AFib, and died of a massive stroke in 2008. Mother had rheumatoid arthritis and Alzheimer's and died of lung cancer in 2012. There are no known medical problems with either sibling. Respiratory system. Shortness of breath, which is his chief complaint. History of pneumonia as early as 6 months old, reporting having pneumonia within the last 5 years. Has a diagnosis of COPD asthma and takes albuterol for relief. He has a frequent cough and green sputum production. The sputum has liquid consistency and no odor. pain with coughing in back and chest, no audible wheezing from inspection. He presents as tachypneic, can see and hear slow, deep inspirations from inspection. Physical examination. Upon inspection, a 1-to-1 ratio was found for the transverse diameter. No injuries or deformities were found. His chest is symmetrical. Some cyanosis is present in the lips. His breathing pattern is tachypneic. Some distress noted. He has a deep depth of breath. Rate is 24. Cough present. Frequent. Green sputum production. Aggravating factors are movement. Alleviating factors are breathing treatment. Palpation. Trachea is midline. Expansion posteriorly is present. Tactile freminess is symmetric and decreases as tested lower on the back. No deformities present in ribs and thorax posteriorly. Upon auscultation, no adventitious lung sounds found anteriorly or laterally. Wheezes found posteriorly, louder wheeze after cough, present more on the right posterior than the left. Negative bronchophony, egophony, and whispered pectoriloquy tests. Musculoskeletal. Weight is 357.6 pounds. The patient is obese. Trauma in certain joints from manual labor. No exercise. No swelling, redness, warmth, or deformity in joints. Does have limitations in range of motion. Does have limitations in performing daily activities. Weakness present in his back and knees. History of arthritis present. Father had osteoarthritis and mother had rheumatoid arthritis. States that he has arthritis present in his back and knees. Upon a physical examination, inspection and palpation, muscle mass and bone structure are normal. Gait and posture were unable to be tested due to his fall risk. Scoliosis was negative. All joints tested and no erythema, inflammation, crepitus, and warmth found. Joints with limited ranges of motion include neck, with a limited range of motion in hyperextension, wrist, with a limited range of motion in circumduction, fingers, limited range of motion in extension, hips, limited range of motion in abduction, adduction, flexion, extension, and circumduction, knees, limited range of motion in flexion and extension. Pain is also present. Spine, limited range of motion in flexion and extension. Pain is also present. Muscle strength. Bilaterally, the deltoids, biceps, and triceps are graded a 5. The wrist has a grade of 3. The fingers have a grade of 4. Bilaterally, the hips have a grade of 2. The quadriceps and hamstrings have a grade of 3 bilaterally, and the ankles have a muscle strength of 4 bilaterally. Pertinent System 1. Cardiovascular. The patient presents with hypertension, obesity, and does smoke. These are common causes for cardiovascular diseases. A study from the Journal of Psychology and Health looked at the risk for acute coronary syndrome in people with depression and their marital status. The study, done over 10 years, found that those diagnosed with depression or had a single marital status were at a higher risk for fatal cardiac events. The patient is both single and has a diagnosis of depression. With all of his risk factors, a cardiac assessment is pertinent. Pertinent System 2. Neuro. In the Journal of Human Hypertension, a study found that obstructive sleep apnea was related to hypertension and obesity. It also found that individuals with obstructive sleep apnea are at a higher risk for stroke. The patient has obstructive sleep apnea, hypertension, and is obese. These are all risks for clotting of the carotids and an increased risk for stroke. The patient also has a family history of stroke. Therefore, a neuro exam would be necessary.